providing that good deal to consumers, then maybe we can't just charge exorbitant rates and then mistreat our consumers. So it gives them a benchmark from which to operate. Now, my point is, this is sort of like the belt and suspenders concept to keep up your pants. You know, the insurance reforms are the belt. The public option can be the suspenders. And what we're trying to just suggest to people is that all these things are important. And that if the debate ends up being focused on just one aspect of it, then we're missing the boat. If all we're talking about is the public option, then the 80% of the American people who already have health insurance in the private insurance market, they say to themselves, well, what's in it for me? Their attitude will be, this is not relevant to me. And in fact, they start getting scared, thinking maybe what the public option means is that you're going to force me to give up my current private insurer and go into a public option. That's what those who are opposed to reform have been counting on, is to try to twist the debate and feed into Americans' natural suspicion about government, and to use that to cloud the fact that right now people are not getting a good deal from their insurance companies. So I just want to make sure that we're focusing on all the elements of reform, what will benefit people without health insurance, what will benefit small businesses, what will benefit people who do have health insurance, so that we can build the largest coalition possible to finally get this done. Okay? All right. Go ahead. Here, you got a mic right behind you.
Thank you. Hello, Mr. President. I'm Katina Rojas-Joy. I was a convention delegate.
Good to
Prince
see you,
George's
Katina.
County, Maryland. I have a two-part question. One is choice. The choice that we make to eat the foods that we eat and the lifestyle that we choose to engage in. And the second part, your family is very fit. What do you and the First Lady and the girls do to encourage physical fitness? And what can we, not the government, not private corporations, do to encourage activity in the public school system and in young people?
Well, this is a great question. Look, this is an interesting statistic. If we went back to the obesity rates that existed back in the 1980s, the Medicare system over several years could save as much as $1 trillion. I mean, that's how much our obesity rate has made a difference in terms of diabetes and heart failure and all sorts of preventable diseases. And so what we want to do is to, first of all, in healthcare reform, in the legislation, encourage prevention and wellness programs by saying that any healthcare plan out there has to provide for free checkups, prevention, and wellness care. That's got to be part of your deal, part of your package. And that way nobody's got an excuse not to go and get a checkup. Now, even if we do all that, and there are a lot of businesses out there that on their own are already providing incentives to their employees. Safeway, for example, is a company that has given financial incentives to employees to make sure that they are taking care of themselves and getting regular checkups and mammograms and colonoscopies and so forth. And it has saved them a lot of money in terms of their premiums. So there's a financial incentive for a lot of businesses to get in the business of prevention and wellness. But you're absolutely right that even if we've got legislation, even if companies are encouraging it, part of what we also have to do, though, is teach our children early the importance of health. And that means that all of us have to, in our communities, in our places of worship, in our school systems, encourage nutrition programs, provide young people outdoor activities that give them exercise. And Michelle and I always talk about the fact when we were kids during the summer, you know, basically mom just said, see ya after breakfast. You were gone. You might run in, get some lunch, go back out, and you wouldn't be back till dinner. And that whole time, all you're doing is moving. Now, unfortunately, times have changed. Sometimes safety concerns prevent kids from doing that. Sometimes there are a lot of kids that just don't have a playground. Little leagues may be diminished, that means that we as adults in the community may have to provide more and more outlets for young people to get the kind of exercise that they need. When it comes to food, one of the things that we are doing is working with school districts, and the child nutrition legislation is going to be coming up. We provide an awful lot of school lunches out there and reimburse local school districts for school lunch programs. Let's figure out how can we get some fresh fruits and vegetables in the mix, because sometimes you go into schools and you know what the menu is. It's French fries, tater tots, hot dogs, pizza. And now, that's what kids, let's face it, that's what kids want to eat anyway. So it's not just the school's fault. A, that's what kids may want to eat. B, it turns out that food's a lot cheaper because of the distributions that we've set up. And so what we've got to do is to change how we think about, for example, getting local farmers connected to school districts, because that would benefit the farmers delivering fresh produce, but right now they just don't have the distribution mechanisms set up. So, Michelle set up that garden in the White House. One of the things that we're trying to do now is to figure out, can we get a little farmer's market outside of the White House? I'm not going to have all y'all just tromping around this, but right outside the White House, so that we can, and that is a win-win situation. It gives suddenly D.C. more access to good, fresh food, but it also is this enormous potential revenue maker for local farmers in the area. And those kinds of connections can be made all throughout the country and has to be part of how we think about health. Okay.
Sir, we have time for one more question.
One more question. All right. This gentleman gets the last question here. Here, you got a microphone right there.
Thank you, Mr. President. Fred Smalls, the city of Laurel, Maryland. Mr. President, there's a large number of young adults who are trying to figure out where they fall into the health reform plan. Many of them are too old to be continued carrying on their parents' insurance plan, yet they may be underemployed and cannot afford good health care. How does your plan account for these young people?
Well, it's a great question. Look, first of all, one of the things that we've proposed is to extend the number of years that young people can stay on their parents' insurance plan to 25 or 26. That then fills the gap between college, where typically they can get health care, and those first few jobs they get. I remember my first few jobs, and you're broke, and a lot of times they're not giving you any health care. And if they do offer you health care, you're opting out of it because you're trying to buy food, which you think is important for your health. So being able to stay on a parent's health care plan a little bit later until you've got a more stable job, that can help pull in a whole lot of young people. Now, after that, it turns out that young people are actually relatively cheap to insure. And so them being part of this pool, part of the exchange where they can go directly and buy health insurance, they will be able to get a premium that's priced comparable to if they worked for a big company. Now, it's still going to cost them some money. And there are going to be some young people out there who still would prefer, even if they can afford it, just not to get health insurance. And this is where there are going to be some young people who may be frustrated, because what we're going to tell them is, you know what, we don't want to treat you in the emergency room where everybody else has to subsidize you if you get hit by a truck. So you are going to have to buy some minimal coverage, just like you have to do with auto insurance, to make sure that at the very least you're protected against some sort of catastrophic illness, and that you're also able to get some regular checkups. But it will be affordable based on a sliding scale based on their income. And then there are going to be hardship exemptions. There are going to be some folks who fall in a different category. They may be a little bit older. They're quite poor, but even with the subsidies, they still just can't afford health insurance. And we may have to give some hardship exemptions to folks like that, where basically we say to you, okay, if you have the option of buying insurance at let's say